Caraga Kontra COVID-19, bringing you the updates of the Corona Infectious Disease 2019. Maayong adlaw Caraga Region ug sa mga gasubay online. Kini nga programa giuluhan sa Department of Health, Caraga.
Maayong gabi. Ani ana sabta karon sa programang Caraga Kontra COVID-19. Ug karong gabi una, akong giyawhag atong Regional Director, Jose Aliacuna Jr. para sa paghatag sa breaking news.
Maayong gabi kanatong tanan. Mga kaigsuunan ganina na dawat sa CHD Caraga gikan sa Southern Philippines Medical Center ang resulta sa 7 ka suspect cases nga na-admit sa Nasipid District Hospital, Butuan Medical Center Annex, Butuan Doctors Hospital, San Francisco Doctors Hospital ug sa Caraga Regional Hospital. All tested negative. The first follow-up of that third COVID positive 10-year-old female child in Butuan City also tested negative. Unfortunately, the third follow-up of that 65-year-old male admitted at Caraga Regional Hospital is still positive. Matod pa sa iyang doktor, maayo ang iyang pagkabutang dito sa hospital. Ug ugma pohon, himuon niya ang rapid diagnostic antibody test nga mo iyang sunod nga lakang sa pag-atiman sa maong pasyente. On the national scene, we have 8,488 cases, recoveries of 1,043, and deaths at 568. Dinhi sa Caraga, mga kaigsuunan, 2 confirmed cases. Ang usa, recovered na. Ang ikaduha, positibo gihapon. Ang ikatulo, ang first follow-up case is already negative. Probable cases, 0. O ang cumulative nga suspect cases reached 42, 15 of whom were already discharged. Ang nabilin, 27 kabuok, admitted in these different facilities. Sa CRH, 4. Sa 401st Brigade, sa Agusan del Sur, 2. Sa Butuan Doctors Hospital, 8. BMC Annex, 7. BMC Main, 1. Nasipit District Hospital, 2. San Francisco Doctors Hospital, 1. O sa MJ Santos Hospital, 1.
Daghang salamat, Director Lacuna. O karon atong klaruhon nga dili lang ang Caraga Regional Hospital ang nagdawat og mga COVID-19 suspect patients. Ania ang OIC Medical Center Chief sa maong hospital si Dr. Cheryl A. Gutinga para sa pagklaron niini.
Good afternoon. It's been 48 days since Caraga Regional Hospital started to admit COVID-related patients in the emerging and re-emerging infection disease or ARID ward. At the beginning of this battle against COVID-19, the hospital has been identified as a COVID referral hospital. Since then, it has admitted 15 patients with 2 confirmed positive cases. Currently, we still have 4 patients confined with 1 positive case. It is noteworthy, though, to mention that in Caraga region, there are already 22 hospitals accepting COVID patients, including CRH. 10 are level 2 hospitals and 12 are level 1, with a total of 62 isolation beds and 14 ICU beds. There are presently 24 patients admitted in the whole region with 2 confirmed positive. With the increasing number of cases, our hospital has established guidelines that will ensure protection of our healthcare personnel from acquiring the disease. This includes guidelines in donning and doffing of personal protective equipment or PPE, and guidelines for healthcare personnel with potential exposure to patients with COVID-19 disease. In line with this, The arid healthcare personnel are required to have a 14-day quarantine within the facility after their tour of duty. They also underwent RT-PCR tests which showed negative results. With this, we would like to assure you that we will continue to strengthen our infection control measures for the safety of our personnel and the community. We also hope that we will be able to serve everyone to the best of our abilities. Thank you and keep safe.
Thank you, Dr. Gutinga. Aniasab karon atong representative from Overseas Workers Welfare Administration or OWA, Caraga Region Office, ang ilang OIC Programs and Services Division, Mr. Rodel P. Deleguero, OWA Officer 2 para sa paghatag sa ilang mga lakang bahin sa COVID-19.
Maayong adlaw sa ating fellow Caraganons, especially to our beloved OFWs. We at the Overseas Workers Welfare Administration is here to provide you the initiatives we have undertaken to provide assistance to our OFWs, as well as updates on the implementation of the DOLI ACA program for displaced workers, or OFWs. In view of the pronouncement of His Excellency President Rodrigo Duterte under Proclamation number 922 and 292, and pursuant to the implementation of the regional community quarantine in Caraga region to contain the spread of COVID-19, the Overseas Workers Welfare Administration Regional Welfare Office Caraga have taken the following measures. First, we have adopted the 4-day work week with flexi-time services from 7 a.m. to 7 p.m. starting from the 3rd week of March. So, ibig sabihin po, we have only 4 days of work each week from Mondays to Thursdays, and magsugod ang among oras sa opisina is 7 a.m. until 7 p.m. So on Fridays walay opisina ang OWA starting March 3rd week of March until the 31st of March. With the expansion of provisions under the Executive Order 22 issued by the City Government of Butuan, Regional Welfare Office Caraga implemented the 25% skeletal workforce complement at the onset of April 2020. So, ibig sabihin po, ang mga empleyado sa OWA, back to 5-day work week, pero each employee will have a office duty of 2 days. Ang ilang remaining 3 days will be on the work from home scheme. So, starting April and until present. So as part of the efforts to mitigate the spread of COVID-19, ito po yung mga ginawa na measures ng additional measures ng OWA Regional Welfare Office Caraga. So we have placed covers in the office front line to serve as barriers from our walk-in clients. And di lang po dito sa labas ng office but on the inside po as barriers of the walk-in clients. So as well as our official vehicles, we have NAMI2 local official vehicles, and we have also placed plastic barriers sort of division from the front seats from the back seaters po. So during office official travels, maybe local or region-wide, we also provided hand sanitizers and alcohol to clients prior to entry in the office, and we have the provision of face mask and vitamin C to all OWA staff on duty. We also conducted disinfection in the entire office last March 25 this year. Ongoing coordination din po yung ginagawa namin sa mga provinces natin or municipalities or cities regarding po doon sa mga stranded OFWs natin that are stranded from some parts of the country who wanted to go back sa kanilang place of residency. And another initiative po is that we have placed station one family welfare officer Bislig City sa LGU nila, and we have also one administrative office staff na naka-station sa LGU Cabadbaran City Ang purpose ani is for those clientele nga natuwa sa mga um, nasabing lugar na kung naa sila ituyo sa OWA, dili na sila direct mo sa regional office since layo, dito na lang sila sa LGU moduol sa among mga naka-station nga employees for their queries regarding OWA's programs and services. So, as of today, OWA Caraga has recorded a total of 135 stranded OFW Caraganons in various places in the country, of which 73 are from Agusan del Norte, 21 from Agusan del Sur, 18 from Surigao del Sur, 21 from Surigao del Norte, and 2 are from the province of Dinagat Islands. Now, these Caraganons, Caraganon OFWs have been subjected to a 14-day quarantine and swab testing upon completion of the mandatory quarantine period. And moreover, the agency has monitored 3 OFWs bound to Davao City and Cotabato who are stranded in Caraga. One of them is still on a 14-day quarantine in the 401st Brigade in Prosperidad, Agusan del Sur, while the remaining 2 OFW seafarers have already completed the 14-day quarantine in Picharao, Agusan del Norte. On April 11th, and we have already a certification of quarantine completion issued by the local health office. Last Saturday lang po, April 26, one of them successfully returned to his hometown in Sultan Kudarat with the assistance po given by the provincial government of Sultan Kudarat and in coordination also of OWA Region 12. Presently, our stranded Caraganon OFWs have been coordinated with the local government units for their monitoring and possible assistance. Kaya nga itong mga stranded na OFWs, they have requested for transport or repatriation back to their domicile or kanilang place of residency. And at present po, well coordinated with the LGUs, kay isa sa mga requirements kung na mag-request usa ka even katong mga regular nga katawhan kung mag-request karon nga muli sa ilang lugar na agid siya letter of acceptance or certification from the receiving regional or local government unit nga dawaton siya pagsulod. So mo na siya ang mga kasalukuyan niya ginalihok pod sa atong mga empleyado dito sa opisina sa buhatan sa OWA Caraga. On the other hand, OWA Caraga together with the DOLI is implementing the DOLI Abot Kamay sa Pagtulong program or the DOLI ACA program for the OFWs who are displaced from their jobs on account of COVID-19. As of press time, a total of 3,060,000 pesos have been released so far with a total of 306 OFWs in Caraga benefiting for the said program. And last Friday, the total na among na endorse sa DOLI Regional Welfare Office is nana siya sa 350 plus and counting na pa may mga gina-process po karon nga approve applications. So every time nga namin approve, we will endorse it to DOLI for the release of the funds. So that would be it for today sa OWA regional office. Those are the measures nga ginabuhat sa mga buhatan sa OWA, and rest assured sa atong mga especially sa mga kliyente sa atong OFWs, beloved OFWs in the entire Caraga region nga mga empleyado sa OWA niya permi nagalihok nagatrabaho kanunay ng serbisyo sa inyo ha abot sa among kaya, because these are the mandates among gigumitan isip trabahante sa OWA. Daghang salamat o ayo-ayo, stay safe, stay home.
Sa inyong suporta kontra COVID-19. Looking forward for strengthened partnership and collaboration. Sa makausab, akong giawhag atong Regional Director para sa iyahang closing message.
Unan, samtang kita ana sa general community quarantine, magpabilin gihapon ang atong strict home quarantine ug pagtuman sa cough etiquette, frequent hand washing, physical or social distancing, pagkaon sa luto o masustansya nga pagkaon, pagkangkon sa insaktong tulog, pahuway o exercise. Mga kaigsuunan sa makausapa, daghan kayong salamat sa inyong makanunayon nga pagsunod sa atong mga guidelines. Kung kita magtinabangay, kita mahimong malampuson sa atong panglimbasog. Mga kaigsuunan, padayon ang Caraga Kontra COVID campaign.
Thank you so much, Director Lacuna. Atong kanunay gabesuhan ang tanan nga magpadayon sa pagpaminaw lamang sa mga opisyal nga balita. Para sa dugang impormasyon, text or tawag ani nga mga COVID-19 hotlines. DOH Caraga hotline numbers 817-6546, 0945-359-2632, 0948-224-1857. For mental health and psychosocial support services through telecounseling for Caraga State University, adunay pipila ka mga numero nga pwede naton tawagan, depende sa oras. For National Center for Mental Health Crisis hotline numbers, kindly dial the following numbers. Aguzan del Norte. Aguzan del Sur. Surigao del Norte. Surigao del Sur. Province of Banagan Islands. For DOH official Facebook page, kindly like DOH Center for Health Development, Caraga. Og mao kadto ang balita karong gabi una. Daghang salamat, mayong gabi, stay safe, Caraga.